Okay, I've got 5:02, we're running 2 minutes behind. I'd like to call the October meeting, of the Albany County Legislature's Health Committee meeting to order. I am going to take some items out of order. Some of the local laws, local law F and local law G will move to the end. I think Ally's on her way upstairs now. Can I get a motion to approve the previous meeting minutes?
Motion.
Motion made by Ally McLean Lane, second by Zach Collins, all in favor?
Aye.
Any opposed? Oh, I'm sorry, what did I do?
Call her Ally.
Oh. Sorry, trying to move it along here, because I
That's
know we got
okay,
a
that's
little bit
okay.
of a lengthy
Next
agenda here. So we'll hold off previous business items number 2 and 3 until after we get to agenda items, move on to current business. Number 4 is the Health Department authorizing an agreement with the New York State Department of Health regarding the tuberculosis testing and asylum seekers grant and amending the 2023 Department of Health budget. And we have Commissioner Whalen. I didn't see you there, I'm sorry. I committed to the end. I think today's your last day,
Today's my last day.
and here you are at the
okay.
Health Committee just to even,
After hours.
Oh, I couldn't miss it.
well, it's been a pleasure and honor serving with you, and
Thank you.
I think we've made comments earlier this week that our county is healthier and safer because of you, and I think the chairman said you've saved lives, so thank you
so
for everything
much.
you've done, and thank you for being here.
And it's been a pleasure working with the Health Committee all these years as well. Thank you. So we're here tonight to request a grant acceptance in the amount of $500,000 for TB testing for asylum seekers. This is the population of asylum seekers that are currently in Albany County and under the auspices of DocGo.
Any questions from the committee?
I do.
Question from Ms. Willingham?
This says it's for April of 2023 through March, okay? But it also says that it will not take effect until the date executed by OSC. So when did they do that?
The timeframe of this grant, they're piggybacking on our standard tuberculosis grant that we get from the state. This is additional money on top of that, but the timeframe just lines up like that.
Okay. Okay. All right, so we already had money then. There was already money set forth. There was already dollars set forth for this?
Not for this particular population, but for the effort in general, yes.
Okay, so, I'm just trying to read this. So a budget discussion was held on the 29th of August. All right, so does this mean we started serving these people, or we're going to start serving them?
We're going to start, yeah.
Oh, okay,
Yeah.
but we haven't started yet.
No, we haven't.
Okay.
Well, that's not completely true. We did initially have an event at one of the hotels just for the children, because you'll recall that that was in August, and we wanted the children to be able to get into school. So we partnered with Whitney Young, and went out and did TB testing on all the children, made sure they had physical examinations, and made sure they were up to date with their childhood vaccinations at the same time that they were enrolled in the school district, so that they were able to start on time. But the rest of there's probably about another 600 that are adults, and that is what we're talking about here.
Okay, so let me just ask you a question. So you said you were making sure that the children were up to date on their vaccine. How would we know that?
So, good question. Some of the kids come in with vaccination cards, like a medical record from their countries. And if we don't have clear records, we vaccinate them with all the childhood vaccinations. It's not going to harm them, and it is going to ensure that they're protected and that they meet the standards necessary for entry to school.
So the parents have to give permission for these kids to be vaccinated, is that
Yep.
correct? Did we have any who wouldn't?
No,
Okay, all
none.
right, thank you.
Oops.
Any other questions from the committee? We get a motion to move. Motion made by Mr. Ward, second by Mr. Miller. All in favor?
All right,
Any opposed? It's unanimous. Thank you, Commissioner Whalen,
Thank
for
you.
everything.
Thank you very much, everybody.
Just to update.
Okay, now we'll move on to the Department of Mental Health. There are items here that can be grouped together. Items 5 through 14. They're all Office of Mental Health related contract renewals, 100% state funded, pass-through contracts. We will need a motion to group, I believe.
I'll make the motion to group
Made by
5
Mr.
through
Ward.
14.
Second. Are you seconding that, Ally? Or-
Yes, I
Okay.
am.
That's by Ellen McLean Lane. We've now grouped items 5 through 14. All in favor?
Aye.
Any opposed? Commissioner?
Good evening, Mr. Chairman.
Thank you for the grouping. It makes it a little easier to talk about these. The first group is an annual set of renewals for our OMH contract agencies. These are, I've been here before to talk to you about these contracts. They're 100% state funded. We are basically the fiduciary, and we have oversight over the contracts. But these are state-issued program contracts.
Thank you, Dr. Whalen. Any questions from the committee?
Dr. Giordano. Mr.
What did I say? I'm
Dr.
sorry.
Whalen.
Dr.
That's all right.
Giordano, I'm sorry.
It's actually
Skylar Brandt
flattering, so.
You're really good,
Must be
you
having
catching
a stroke.
everything tonight.
Ally?
Does this also encompass substance use disorder? or-
That's the second grouping.
There you go.
Yeah, we'll do those second, but, so, any questions for items 5 through 14? Hearing none, can we get a motion made? Motion made by Mr. Miller, seconded by Mr. Ward, all in favor?
Aye.
Any opposed?
Okay.
Okay. And again, items 15 through 24, similar to the last group, these are all OASIS-related contract renewals. Can we get a motion to group items number 15 through 24? Motion made by Ellen McLean, seconded by Mr. Ward, all in favor?
Aye.
Any opposed? Dr. Giordano.
Yes, Mr. Chairman, this is very similar in nature to the OMH contracts. These are long-standing contracts, and these, we're seeking to renew them for the coming year. 100% state-funded, issued by OASIS, and we have contract management responsibilities.
Thank you, Doctor. Any questions from the committee? Hearing none, you got a question, Wanda?
Yeah.
Sure, go ahead.
I don't mind grouping things together, but, and these are contracts that, you know, have come from the past.
Yes,
Okay.
ma'am.
But the one thing that has always concerned me is a report on how well these organizations are doing with the money that we're giving them, okay? And I really would like, I think it should be a matter of course that we get something that says, you know, I don't know if they're in their third year, and they've been grouped because, you know, that 3-year thing that we do, you know, and then whether it's 1 year at a time. But at some point, I just think that, I'll say myself, I think that I'm owed some type of report that says these people they're doing this kind of a job. This many people that they've served. You know, the outcomes have proven to be just what, you know, we contracted them to do, okay? And I know you had to some way rate them to even give them the contract to begin with. So at some point, you should rate them again to see if they're, you know, really operating under the standards that we want them to. And that's all I had to say. You know, I'm gonna go by this because, you know, I really do, I support the work that you do. But at the same time, it's, you know, I'd just like to say that.
I appreciate the comment very much, and I appreciate the trust, but I will say that, you know, we're not going on trust here, and I can produce for you any of those reports that you should ask for. The tricky part is some of these programs are licensed by the state, so they undergo regular reviews. Some of them are not, and we take those reviews on our own. But we have utilization and outcome data on all of these programs. So we could easily send you, and we distribute that in our circles. So we could start including you guys in that if you wish. The trick with programs, there's two things I would just say. One is when there are underperforming programs, and there have been in both the OMH and OASIS side, you know, we try to work with the programs to get them up to speed before we would make a move to try to close them, because the obvious liability there is there are, in many of these programs, hundreds, if not more, clients and patients who would then have nothing. So we work with underperforming programs as best we can. But there also is, I think, and addiction in and of itself, across the board, the data is It's not 100% cure when you go through addiction treatment. But we can show you numbers and demographics and outcomes on all of these programs. So,
Thank you, Dr. Giordano. First aid alley, then we'll go to Mr. Ward.
A very quick question.
Sure.
Do you have numbers on recidivism rates within the SUD population that receive funding from Albany County? Maybe not. I don't
well,
know.
first of all, I think it's important to understand there's no Albany County money in any of this. This is 100% state,
Yes, yes.
and the state has the same interest as you guys do in terms of answering these kinds of questions. Recidivism is tough. We often deal with this at the jail because you can go through drug treatment, you can go through it 2 and 3 times.
Yes.
And then in 18 months, some life circumstances occurs which has nothing to do with the treatment and someone relapses. I take it you meant relapse, not recidivism in the sense of arrest.
Oh, yes, that's
Yeah.
what I mean.
So so there's kind of like national data on relapse
Okay.
that we apply to the state. But people go through programs multiple times.
And I don't disagree with that at all.
Yeah.
It's just good to know.
Yes. yes.
Thank you.
Sure.
Mr. Ward?
Yes, Dr. Wright, we just approved we're about to approve 20 contracts here. You mentioned that some are regulated by the state and
Yes.
some by the county. Do we have a percentage of, or a rough
We
percentage?
could certainly give you that. There are a whole host of other programs
Right,
that aren't even here today that are purely licensed and funded directly by the state.
okay.
We have a quality of care oversight of that network, so
Mhm.
they're involved in our daily world. These are programs that mostly, the majority of these are not licensed by the state, and so we try to review each of these programs on a biannual basis.
Yeah.
So the majority of these, I would probably say, are not licensed by the state.
Okay. It would be interesting data to have, though,
Sure.
if it's permissible to release it. yeah.
That data is all there. We have more data than we know what to do with sometimes, so if you ask, we'll try to give it to you.
I don't want all of it, I just,
No, I think,
You're right.
Oh, I appreciate it,
yeah, yeah.
thank you.
Ms. Mohan?
Yeah, I just want you to keep in mind that we just lumped together millions of dollars, okay? Just let me finish. We lumped together millions of dollars to just, quickly go through. And so, and you just stated and clarified that these were not state mandated programs. We contracted with these people, is that right? But you said
No.
I misunderstood you then.
All of these contracts are, all of this money comes from the state.
Right.
The state has decided which programs get them. They give the money to
Okay.
the counties because this is our way of eyes on the ground, overseeing the quality of those programs. But some of these are actually licensed programs by the state. Some of them are not. Yeah, I'm sorry. I'll try it again. If you ask the question again, I'll try to.
Okay, so.
We have responsibility for all of these programs. There are many programs in Albany County that, for example, are run through the Medicaid reimbursement. We don't give them any money, but we watch them and we monitor them and we try to ask these questions about recidivism and relapse and quality of care, but it's totally outside of us. The state has a number of programs that are not formally licensed, and really that means they're not Medicaid reimbursable. So the state has to give them money to operate, and they give the counties the responsibility to oversee those. So most of these programs are not 100% Medicaid because they can't cover their bills.
Yeah, yeah.
So we're really the guardians of the state money,
Mm-hmm.
because the state has 57 counties to do this with, and every county has the same thing.
But we are responsible for maintaining how well they're doing their work.
Yes,
We're
yes.
responsible for
I
that.
would say that is an accurate statement.
All
And we
right.
do our
I
best.
just learned something new.
Was that?
I said I just learned something new,
Ah.
the little nuances of, mandated and
It
just.
is nuanced.
Mhm, okay, thank you.
Thank you. Do we have any other questions from the committee? Hearing none, can we get a motion to move items 15 through 24? Motion made by Mr. Miller, seconded by Alderman McLean Lane, all in favor?
Aye.
Any opposed? Unanimous. Thank you, Dr. Giordano.
Thank you, Mr. Chairman, thank you, everyone.
So we're not done yet, we have to go back to previous business. Number 2.
And the public hearing, for whatever reason, did not make it onto the Granicus agenda, but it is in fact on health as well. It was on law last night as well. Yes, it has been circulated here. That's just a straight public hearing. So the local law F itself is tabled pending public hearing. The public hearing for local law F is before you tonight to determine whether to move out.
Second hearing. So we need a motion to table it, or?
Nope, it's
Okay.
not for number 2.
Before we table, can I just ask a quick question of the sponsor?
Sure.
I don't know if I have the most current version of this local law. Paragraph C, it recurs twice in the local law about no notice is required if it's a relocation of an existing facility. But, so we do have a clause in there about notifying schools if you're within, I think, 1,500 feet. Is that-
This is being, so you can see the brackets that are here, but the number 6 is bracketed as well, that is coming out. So if you look at section, so it's 3 and 4, I just had the help of the wonderful Brandon earlier on this. That number, let's see, 2, 5, and 6 are coming out. So it's going to go down to the Albany County legislator who represents, and then it will go down to, and then it will be the, mayor and or supervisor, et cetera, municipal head, their council, and then their board members. And that's it.
Thank you. Yeah, any other questions before we table?
I do have one other proposed change that we made, but I have time up until the hearing. We would like to, but I have to give some information to majority council for this. What we'd like to do is remove the references to substance abuse treatment and make it so that it's upon receipt by the Albany County Department of Mental Health as identified as a local governmental unit by the state of New York. That would, probably a notice, so that we can move that out of there. It was mentioned by the advocates, and I did want to honor their request,
Okay.
but no one was stigmatized.
Thank you, Ally. Any questions for the sponsor?
No, this is just on the public hearing,
Public.
right?
Yeah, no, we have to table number 2, but there's an item 25, I believe, that we have to vote on, which is the public hearing itself.
Yeah, that's what we're
That's
tabling this one for now.
That's correct.
Yeah, Ally knows we've had some discussions, I still have I have some opposition, but
No, we're trying
until
to
I
do
see that newer version, then I'll just wait till after the public hearing.
Sure, okay. So can we get a motion? Oh, we don't, okay, so we
I have
don't.
the table pending public
Very
hearing.
confused.
Yep.
So what I'll do is,
Take 25.
yeah, we'll take 25 out of order because it's the public hearing for local law number F.
It's not,
Will be-
November 21.
Thank you.
November 21 for the new public hearing date, which is the second public hearing on local law number F. Need a motion to move?
Make that
Motion
motion.
by Mr. Wood, second by Riley McLean Lane. All in favor?
I
Any
should have,
opposed?
actually, I'll
No,
defer
no.
to my colleague, the sponsor for,
Switching.
I wasn't sure you were on the health
She'll
committee.
sponsor, yeah. Sure motion, you'll second.
Motion
Absolutely.
made by Riley McLean Lane, second by Mr. Ward. All in favor?
Aye.
Any opposed? Thank you. Number 3. 3 months, I swear we're not gonna jump around. Local law number G for 2023, local law of the County of Albany, New York, amending chapter 242 of the Albany County Code to prohibit the use, smoking and vaping of tobacco or cannabis products at county properties and in county vehicles. Any questions for the sponsor? Ally, you want to say a few words on this, or?
I did contact the Tobacco Free Coalition. There was somebody that did show up, a couple times and public forum, et cetera. And I have not, they was talking about perimeters, but it wasn't very clear what changes they were looking for. I hope to have something, you know, they're not a lobbying entity, I just wanted some, you know, some of their education piece. I have not heard back from that individual as yet. I've contacted them 3 times.
Mr. Miller?
Yeah, so I was gonna ask a question, but it goes to what you're talking about, because they have contacted me since this came out. And I'm not against this, obviously, at all, I'm on this,
of course.
but,
I don't know why they didn't contact me.
I don't know either. Well, I just saw them they were sitting behind me at one of the meetings, so.
Yeah.
So the question, I think they were, on section 5, letter C, that the 25-foot, no speed within 25 feet. I think they were concerned that that was like, let's just say, take the Department of Health, for example. That's in a parking lot, that's an area that we have control over. Why would you put their concern was, why would you put a cone there? We should just ban it altogether. But I think we spoke even to Rebecca at times, and I brought up the point of, say, probation. Probation is right on Pearl Street, right? So what it basically does, if you put the 25 feet, it's out of the street. I don't know if you want to talk about it better, but it puts it out to the street, so that's.
Yeah, I mean, for the buildings that front right up on a street and not on a county-owned parking lot, it does provide some protection because it does put in the 25-foot perimeter, whereas normally people could just smoke outside the building automatically because it is a city-owned street and a city-owned sidewalk. But this just puts in the perimeter, and so it does offer some measure of protection. I understand what they were saying certainly about the perimeter and how that can be a problem in some cases, but this does give some protection for those buildings that front right on the street.
They were concerned on the other one, like I said, that it was a free zone. Like if you walk 25 feet into the health department parking lot, then you're all good.
Well, the health department parking lot is Albany County property.
That's what I mean, that's what I'm
So
saying,
not
that's,
all good.
no, it wouldn't be, that's the whole
Yeah,
point. They
yeah.
thought, and who's gonna measure the 25 feet, and then who's gonna stand out there and check that, but it doesn't, because it's still our parking lot.
It's still our
It's for those
parking
places
lot.
where you're front into a public road, like it's like a Pearl Street. So I
Mm-hmm.
think they were okay with that. If they understood it that way, I took that they were okay.
Well, I would be more than happy to speak to them about
Right,
it
right.
and make any suitable changes they see fit.
I think, yeah, once they understood what it meant, I think.
Got it, wonderful, thank you.
I believe,
appreciate
I don't speak for them, but that was my
No, it's
understanding.
fine.
Mrs. Willingham?
Thank you. Now that he brought that up, now is there what's the signage for this specific, issue that he just brought up? So how will people know that they're within 25 feet of a county building?
Well, they don't, I mean, nobody's going to be, it's just signage, it just says what it is, that's all it does. I think people have a really good understanding of maybe 12 inches is a foot. Now, are we going to be actively going after people if they're at 24 feet? Probably not, I think that is a waste of county resources. But what it does is it gives warning, it says, if somebody's doing it repeatedly, I'm sure that, somebody might finally say this has to end. But it just offers protection, for example, anyone in Health and Human Services, whether it's an employee or it's somebody coming with their children. It's just to provide, right up there, there's some signage. For example, in the county parking lot where I was, where I am quite often, there's no signage about smoking whatsoever, and people are getting high in there every day. I mentioned it at the last, committee meeting that we had. And it's challenging, and if there was just a sign up, I think people are fairly respectful.
I guess for probation, because of where it is, okay? And how people can be, they can get in trouble if they, so,
You don't want to get them targeted?
no, no,
Try to discern.
yeah. And I'm just thinking that that's a little sensitive area, probation would be, okay? And so that's why I'm concerned about the signage. So, especially there,
But this is also not a criminal or this is like getting a parking ticket.
It's not even a parking ticket
Yeah,
because
that's
it's
all
a
it
civil
is.
penalty.
It
Whereas-
would not
Yeah.
reflect on it would not affect their status on probation.
okay? I'm
Because
good.
it's not criminal in any way.
Yeah. And we don't need to criminalize people for doing something that's legal, we just want to protect the air for,
Okay,
our-
I'm with
our,
you. No, I think it's great, I'm with you.
Thank you, I appreciate it.
Any other questions for the sponsor? Hearing none, can we get a motion to move?
Motion.
Second by Ellen McLean. Motion made by Ms. Williams, second by Ellen McLean. Lane, all in favor?
Aye.
Any opposed? Unanimous.
We done?
We're done. Oh, yeah, no, motion to adjourn.
Motion adjourned.
Second, Ward, all in favor?
Let's see you.
All right.
That was.